Air ambulance emergency. Every year, an estimated 550,000 people in the U.S. are transported by air ambulance, a especially outfitted helicopter or plane that can quickly take critically injured patients to hospitals. They often provide rapid response in hard to reach or remote areas where ground ambulances may be impractical. But one Colorado couple tells Denver 7 investigates their insurance company claimed the air ambulance wasn't medically necessary. We're glad you chose Denver 7 tonight. I'm Jessica Porter.
I'm Shannon Ogden. And that family reached out to Denver 7 consumer investigator Jacqueline Allen. She found out why they were on the hook for nearly $100,000. Jacqueline then helped get that bill covered.
When minutes count,
if somebody is having a heart-related condition,
air ambulances can save lives.
Those minutes could make a difference.
But Denver 7 investigates also found the cost can be sky high.
I was shocked. I was really shocked.
And when insurers deny claims,
this case got misclassified from the beginning.
Some customers are caught in the middle.
That was our last step, really, our last hope.
Bob Taylor and his wife Margene
Red Flower started there.
have been puzzling through life together for 43 years.
Yeah, they actually worked.
Some dates, though,
July 7, 2022.
are more memorable than others.
We were just going to hang out with our friends at their cabin. Bob woke me up at like 5 a.m. saying he had chest pains. I just drove like a crazy person for an hour to Alamosa, to the hospital.
Bob was having his second heart attack in 4 months.
They said he needed a higher level of care. And she said, yeah, we always use a helicopter for a STEMI or a heart attack.
They loaded him on a Guardian Air ambulance and flew him about 100 miles from Alamosa to Pueblo, landing at Parkview Medical Center, where his cardiologist was waiting.
Did this procedure save your life?
Yes, ma'am.
So he's doing really well.
That's the good news.
And on my notes, my handwritten notes.
Then came the bad.
Oh yeah, see, here's the initial denial.
So records show their insurer, Anthem Blue Cross Blue Shield, denied their claim for the air ambulance ride, stating it was not medically necessary. And the Taylors owed more than $94,000.
Yes. It gave me a heart attack, almost.
Not funny.
No.
They appealed not just once, but twice, both denied. An independent reviewer upheld the decision, but with this telling note.
Without medical records from the treating physician, it is impossible to determine the medical necessity.
Did they not request records?
Apparently no, and that is a failing on the insurance company.
Adam Fox, deputy director at the Colorado Consumer Health Initiative, says his organization started investigating and discovered a larger issue at play.
How did they determine it was not medically necessary?
We don't know. And frankly, based on what we have learned, they didn't have enough information to say it was not medically necessary. I think this case potentially demonstrated new behavior that is very concerning by both the air ambulance entity and the insurer.
A quick search online and headlines show the Taylors aren't the only ones facing astronomical air ambulance bills in the last few years.
Inevitably, an insurance company is always trying to save a buck.
Lauren Adler, an associate director at the Brookings Institution, has been studying this issue for years. He says the federal No Surprises Act that went into effect in 2022 was supposed to ban surprise bills like this for out-of-network costs. But last year, the National Association of EMS Physicians wrote this letter saying, often with air ambulances, there's been a significant spike in denials of claims on the basis of lack of medical necessity. Under the No Surprises Act, insurers can pass on the charge if it's not medically necessary.
At the end of the day, though, medical necessity is medical necessity. And if the service was medically necessary, the insurance company should be covering it.
However, Adler says insurers have a growing incentive to deny claims. As private equity has moved into the air ambulance industry, his research shows prices have skyrocketed, about 60% more than carriers not backed by private equity.
Private equity came in and saw this opportunity to be more aggressive, to set very high list prices.
Why does this flight cost $1,000 a mile?
It is the cost of being ready to go at a moment's notice, 24 hours a day.
Dr. Melissa Costello is with Global Medical Response, which operates Guardian Flight. She says their crews bring ICU-level staff and equipment to places like rural hospitals and the side of a road after a crash. As prices for fuel and staff go up, this service has become more expensive to provide too.
Why is it up to us?
But she says Bob Taylor's flight should have been covered by insurance.
Somehow this case ended up misclassified, and that's what started this whole thing rolling downhill.
I just felt like we were stuck in the middle of all these companies and nobody cared.
So Denver 7 Investigates reached out to Anthem Blue Cross Blue Shield, and while they declined our request for an interview, in a statement, a spokeswoman blamed unclear communication, saying in part, "In response, we have negotiated with both the hospital and the air ambulance provider to cover these costs and are working together to improve how policies on air ambulance services are communicated in the future."
I'm pretty sure, 100% sure actually, that because you contacted Anthem, they reviewed our situation again, and then they called us.
The Taylors say after 2+ years of fighting, the $94,000 air ambulance bill is now taken care of. Pieces of the puzzle finally coming together, at least for them.
Relieved.
Yes. After we got off the phone, I cannot believe this is done. And I started crying, actually. But I wasn't giving up. I was not going to give up. I was not paying it.
And the Taylors call this their David versus Goliath story. They hope sharing it will help other people in their position.
Wow.
Wow, Jacqueline, you also talked to the air ambulance provider and the hospital about why this particular flight was in fact medically necessary.
Now, this is interesting. San Luis Valley Medical Center defends the decision. They say this air ambulance ride followed their standard procedures. So for some more context, this is a small rural hospital. The air ambulance providers tell me the patient needed advanced cardiac care, so there's no argument he needed to be transferred, but a ground ambulance would have taken one of the only resources responding to medical emergencies in that area out of commission for a round trip of upwards of 5 hours. So coming up at 6:30, we're going to take a look at possible solutions. What needs to change in the air ambulance industry to keep this from happening to other people?
Right. Nice work. Once again, so glad you're on our team. Great work, Jacqueline. We'll see you in half an hour.